recording now, so we should be recording now. So yes, we can record this. So we'll be recording this. If you see down there, there's questions. Please feel free to ask any questions in there. You can either send privately directly to a specific presenter, I believe, or send to all. And we'll be answering questions at the end of this session. So I'm going to take you over the agenda. So this is the agenda of what's going to be going on today. Again, there is a part 2 where we're going to get into more detail. Kristen, who's the Deputy Director over at Health Outreach Partners, is going to start us off with an overview of the Enabling Services Project, and that's all the work we're doing broadly at Enabling Services. And then to get into more detail, Michelle Chrissy out of the Waianae Hills Comprehensive Health Center will be showing us how the Enabling Service template can be downloaded, and then on the back end, the setup and demonstration of that. We're also going to do a little background on some of the different questions that you want to think through at your health center as you're starting to figure out how to do Enabling Services templates and data collection. And then we're going to close with some QA and next steps. So I'm going to move it on over to Kristen. Kristen, are you ready to share your screen?
I'm ready.
Okay, I'm going to share screens over there. Hold on 1 second.
Okay, does that look right?
Mm-hmm. Yes, definitely.
Fantastic. Hi, everybody. It's really lovely to be here with you today. My name's Kristen Steimanoff, and I'm Deputy Director at Health Outreach Partners. We have been collaborating with AAPCHO and with the National Healthcare for the Homeless Council since 2012 to expand the availability of training on enabling services data collection to health centers and primary care associations across the country. And as Heather mentioned, today is the first in a two-part webinar series focused on the really important topic of tracking and reporting enabling services in a health center's electronic health records system. So I will just be giving an overview, and then Michelle from Waianae Coast Comprehensive Health Center will give you really good detail about how they have done this at their health center in NextGen. Here's just a brief slide that describes the mission of each of our 3 organizations. AAPCHO, the National Healthcare for the Homeless Council, and Health Outreach Partners are all national cooperative agreements, and in that role, we all spend a lot of our organizational time and energy providing training and support to health center program grantees across the country. Heather mentioned that it's a 2-part webinar, and today we're going to really cover, it's more of the intro piece, the NextGen utilities that are required to import and access enabling services templates. And on the next webinar on August 3rd, we'll go deeper. So I'm going to start with the very basics, and I just want to start by being really clear about what we're describing when we talk about enabling services. These are the non-clinical services that health centers provide to their patients and community members that ultimately aim to increase access to care and improve health outcomes. So they include things like case management, health education, interpretation, transportation, outreach, eligibility assistance, and recently HRSA clarified that civil legal aid can be included as an enabling service that health centers provide. Providing these enabling services is a really important part of health centers' overall service delivery model, and it really sets them apart from other providers. It can definitely increase people's ability to use preventive care, and it can decrease costly ER use and hospitalizations, make sure people get the care that they need, despite the major challenges and barriers that exist for many of our patients, whether they are language barriers or cultural barriers or lack of access to transportation or lack of secure immigration status. Health center enabling services can really help people get excellent care despite these challenges. They're also key components of being recognized as a patient-centered medical home, and they've been integral to expanding coverage under healthcare reform. So why are we talking about collecting enabling services data? For those of you who work in health centers, you're probably very familiar with the UDS, the Uniform Data System, and you have all kinds of data you have to collect and report in the UDS. This slide shows a portion of Table 5 in the Uniform Data System, or UDS. This is the system where all health centers have to track information on the services they provide, information about their patient populations, their staffing patterns, costs, and other key information. And health centers are required to provide some of the information on their enabling services to the Bureau of Primary Health Care as part of their annual reports, but the UDS really does not track well the full scope of the enabling services that are provided by health centers and that are needed by your patients. So you can see on this table, the white is the part that definitely has to be tracked and reported. So you have to report the number of enabling services staff in various categories in your UDS, but only the number of visits by case managers and education specialists are tracked in the UDS. The number of visits that transportation staff, eligibility staff, interpretation staff, and others engage in do not show up in the UDS, nor do the number of patients engaging in any of these services. So it really is a very incomplete picture. So AAPCHO started this project in 2004, and I'll give you some history in just a moment, but believing that if these services are truly valued and we can really show the value of services with the data, then adequate and sufficient funding should be sufficiently directed to pay for them, and we'll be able to have the volume of enabling services we need to best serve our patient populations when we need it and where we need it. So AAPCHO embarked on this enabling services accountability project in 2004. And the aim was to develop a standardized data collection model for enabling services and a database from which information from individual health centers could be aggregated and analyzed at a broader level. The project also aimed to provide broader information about how enabling services are being utilized and their impact, and hopefully, as I mentioned, serve as a guide for allocating resources and facilitating research. There were 4 health center pilot sites in the study, including Charles B. Wang Community Health Center in New York, New York, International Community Health Services in Seattle, Washington, Kalihi Palama Health Center in Honolulu, Hawaii, and Waianae Coast Comprehensive Health Center in Waianae, Hawaii, and you are about to hear from them. So there were several benefits identified from this initial study, from this initial pilot project. First, around patient benefits, it was found that enabling services utilization was associated with better diabetes outcomes and appropriate childhood immunizations outcomes, despite the fact that the users of enabling services tended to be more likely to be minorities and more likely to have public insurance or no insurance compared to other health center patients. So this graph that you're looking at shows the rate of appropriate childhood immunizations for users of enabling services versus non-users of enabling services in the pilot sites. And then this graph shows diabetes control in enabling services users versus non-users. So the blue part of the bars shows the percentage of diabetic patients with hemoglobin A1C levels at or below 7%. The green is between 7 and 9%, and the tan is above 9%. And you can see that the enabling services utilizers on the left-hand side have better controlled diabetes than the non-users. overall health center benefits for the health centers that participated in the project, as well as those who've engaged in enabling services efforts since, there have been significant benefits. This data, I believe, is from 2008, yes, and shows that the top 10% of health centers investing in enabling services, so those health centers that were spending more money on enabling services staff and associated costs, had better health outcomes, better healthy birth weights, blood pressure, hemoglobin A1C control, childhood immunizations, PAP tests, lots of better outcomes associated with investment in enabling services. There were also lots of benefits to staff participating in this program. The enabling services staff really believed that their services were vitally important for the health of their patients, and they became very empowered to be a part of the implementation project, which definitely strengthened the project overall. Also, there were community level benefits. So being able to have a general assessment of the health status of patients and highlight unique community needs was an effect of this project. And the pilot sites were able to serve as models for others in their community and across the country. And then, of course, overall, having standardized enabling services data really highlights the value of enabling services across the board, brings attention to the need for these comprehensive services to our vulnerable patient populations, lets us track the services that we're providing for grants, for research, and for funding, and really help in allocating time and resources most effectively. It supports patient-centered medical home efforts, it supports payment reform efforts, and is an extremely valuable proposition for health centers to engage in. So I will turn my portion back over, and we'll hear from Waianae Coast to get really specific about the templates in NextGen.
Wonderful. Thank you very much, Kristen. So I'm going to turn it over now to Michelle Chrissy at Waianae Coast.
Hi, good morning. Aloha, can you hear me?
Yeah, perfect.
Okay, good. Before I get started, I'll just introduce myself again. I'm Michelle Chrissy Kuhin, and I say that just because if I go through it and refer to myself as Chrissy, but my email says Michelle, one and the same, so no confusion there. I'm the Director of Electronic Health Records here at Waianae Coast Comprehensive Health Center. I've been here for 26 years this year. I'd also like to let everyone know that I have John Williams, our Chief Information Officer, who is also on the line. He is a valuable resource for answering any kind of questions that will come up regarding the EULA, which we'll go over, so the end user license agreement, when downloading the template, as well as any questions on using the SQL reporting services to gather your data. And we can we'll have a Q&A at the end of this session. So Heather, you can go ahead and add that. So what we're going to go over today in part one is really not the full detail. We're going to save that for part two, where we're going to go through the demonstration of that actually downloading the template, where that can be saved. And for those folks who use NextGen and who are familiar with the NextGen utilities, specifically your template editor and your import export utility, we're going to go over that, and that should sound familiar to you. If you're not, they're very easy to use, and you do need to have some kind of background knowledge to use it. So we'll go over that in part two. But I do want to show, and this is a link that you can actually go to now. So the slide that you're viewing, if you go to that HTTP address, you'll see the same page that you see in the slide. There is a copy of that clinical enabling encounter template, which I'll also show what the template looks like in the NextGen application. Along with that main template, we also have two what we call template pop-ups or accessory templates that hold health education, additional health education service codes that are linked to that parent template, and then another interpretation pop-up. So when you download, you'll actually have three templates that you'll need to import into your test database. And you can advance. Next slide, Heather. Thanks. Okay, and so, oh, sorry, got one more back. We'll talk about before you download, you need to agree or accept the end user license agreement. And really what this is saying is that once you, number one, you should import it into your test database, never into a production database. That there may be things, this is a custom template. So the great thing about that is it doesn't matter what version of NextGen you're on. So if you're familiar with NextGen, you have a KBM version, and then you also have an application version. As long as your version 50 isn't any higher than what we have, which we're at UD2 now and KBM 8.3.10, then you should be fine. So, but it also does say if there are any errors or issues that you need to resolve that you understand that may happen, and we can provide assistance with those errors. But most important, you're always going to import it into a test database or a development database. Also, too, that there's really no liability on our side should it wreak havoc in your database, which it won't. And you can advance. Once you accept that end user agreement, and in part two, we're going to go ahead and go through the downloading of the template, how you can export that into your test database, and then what that looks like in the template editor back-end section. And then I'll go over, we'll take a look at what it looks like in the front end. So what your end users will see, what they will use throughout their visit or workflow to document the services that they provide. What I like to make sure that I point out, because I've had quite a few calls from organizations who download the template and wonder why it's not kind of something that they can just up and start using right away. There's some preparatory work that needs to go along with this, and specifically that's setting up a CPT code and service items. So first thing is you'll need what we did, and mind you, this is not something that NextGen recommends. They don't have a workflow. This is just something that our organization, we figured out a way to set up our database so that we could capture these non-billable codes. We could report on them, and then we also set it up so that we don't inadvertently send any of these codes as claims to any payers. So the first step is we went ahead and set up a CPT code that is assigned a non-billable type of description. And so in your, this should look familiar. So in file maintenance in NextGen, it's just one code, one CPT code. We assigned it N bill with a description of no billing. And that's it for the CPT code. Next slide. Once you set up your CPT code, you can go ahead and set up your enabling service items. Now, this is where you're going to want to have a list of all the enabling services code, all the enabling service codes that you think you're going to use for your organization. There are hundreds of them. It's not to say that you need to or want to use all of them. I've had some organizations that just like to focus on anywhere from 30 to 40 and to track those. It's really going to be dependent on what your organization, what services you provide, and what you want to track. Main thing is once you set up that CPT code, you'll notice there on the CPT4 code field, kind of towards the top in the middle, you'll notice that you have that end bill code there. Once you have that end bill, you can go ahead and create a service item attached to that CPT4 code. So it's just a matter of deciding what codes you want to use. The example I'm using is just a case management assessment code. And some of the things that you're going to want to check off. And when we in part 2, we'll go over this too in detail. You'll want to make sure that you check off your suppressed patient procedures, suppressed billing, prevent charge amount override. Next slide. Okay, the other thing that we did, and really we went ahead and created, so Dr. Bradley is our medical director, we went ahead and created an enabling services provider. And biggest reason is we needed, number one, you need to have a rendering provider. So if you're collecting your service, the services you provide, whether it's through the EMR workflow, or in our case, we have our transportation folks who don't access the EMR side, they actually put in the service code on in the electronic practice management side of NextGen. So either way, you need a rendering provider attached to that encounter. So to make sure that we eliminate any chance of inadvertently sending a claim to any of our payers, we went ahead and we actually use a license, EPM license and an EHR license for Stephen Bradley, and we just added enabling as the middle name. So on both sides, the users know which provider to select, and in some cases, they may just be the default provider. Some things that go along with adding in your provider, just real quick. You can't, I think we have, when I show in part 2, we added, I think, our organization's NPI, but that kind of information you don't need to have in there. Really, it's just they'll need to hold one of your licenses. So an EHR license and an EPM license, so kind of keep that in mind. And it can be a mid-level license. Okay, next slide. Okay, so now for the workflow, I think just mentioned this earlier, there are 2 ways that you can go ahead and enter in your enabling services codes, and this is really where you're going to want to probably think about access. Who is providing the service and what kind of access they already have to clinical data. So I'll give you an example for our transportation folks. They provide transportation services, but their need to know about any kind of clinical information for the patient, in other words, having to access their EMR or EHR record, is not necessary. So we set up a workflow where they already are using the appointment scheduling piece in the EPM portion of NextGen. So they schedule the appointments, they create an encounter, and then they enter that service item directly through that encounter. So they're not accessing EMR at all. And then you have case managers who maybe do both, but they have their own, they use the enabling services template to document the services they provide, along with, of course, their clinical encounters. So that would be an example of using EHR for your workflow. Next slide. Okay, and so some examples of reports. Now, it's great we've now collected the data, and you know, you've set up your workflow. I think one of the biggest things that the next question is, okay, so great, we have it in this database. How do we report off of it? How can we use it to prove that the services we're providing are amounting to improved health outcomes, and whether or not we're using our resources correctly. So in the example that you see here on your screen, we use the SQL Service reporting services to pull from the EMR or the EHR procedure module. So the report that you're looking at is an example of case management and how they track their case managers and the number of encounters and the number of services they provide. So this report typically is used more for a particular department to track their folks in how many hours they're using, you know, that they're putting towards providing these types of services, and again, how many encounters, and then what types of services are most often provided. So this report is a custom report that was put together by our IT folks here. This is something that we certainly can show more detail. But if you have any kind of SQL service reporting background, it's not a difficult report to put together, and you can decide on what parameters you want to assign to those. Next slide. Okay, and then this is an example of just a canned NextGen EPM report. And I like to show this just because if you don't have anyone in your organization that has any experience with SQL Server, you still have the ability to pull some reports from the EPM side, create some custom reports from the utility that's already there. Again, this is from the NextGen EPM side and not the EMR side. This is great if you're having your transportation folks put in information on their service information on the EPM side of NextGen. You can pull things, filter by date, filter by age, and then just even totals for the month. So this gives you a kind of a really good and easy way to see whether or not transportation is being utilized. Maybe if you're interested in figuring out what age group utilizes it more. And then certainly you can set up a workflow so that more than just your transportation folks are entering the data in the EPM section. And then again in part 2, we'll go over in more detail looking at the report filter in EPM, and then again looking at the SSRS reporting or report manager that we use. And I think from here, I'm ready now to show the template from an end user perspective. So Heather, whenever you're ready. Okay, so everyone should see the NextGen application with the clinical enabling encounter template that once it's downloaded, this is what it'll look like in your database. The great thing about this is certainly customizable once it's downloaded to however your organization, whether it's going to be formatting, whether it's going to be workflow. We created this template, I want to say probably at least 5 years ago. And we've actually been collecting our enabling service codes for well over 15 years, even before EHR. I know that we worked with AAPCHO'S to codify service items. So we've been collecting this kind of data for a long time. With NextGen, though, it's given us the opportunity to create custom templates and custom workflows for different types of end users. So in this case, the clinical enabling encounter template can be used by anyone from a case manager, a social worker, to a receptionist, maybe to a referral clerk who is helping someone with their referral, a patient assistance services worker who is helping someone to get assigned to a PCP to help set up some kind of financial counseling. So once this template is downloaded, we have it set up so that there's already a diagnosis code that automatically populates, and that's just your basic counseling NOS code, and that's been switched out to the ICD-10 code. Here is just the comment section. We've left this here just for any kind of information that the end user wants to add in. I think the other thing that you want to think about, so besides your service item codes, we want to be able to track the amount of time. So what's going to happen in part 2, I'll go over in detail how you want to set this up for your procedure codes. But what we did was, I'll give you an example. With the case management referral service, there are units of time that are associated with a particular service. So we have it, we've decided in our organization that you have to spend at least 10 minutes of your time in providing the service before it's documented. Now, how does that 10 minutes NextGen application, we can't record that actual 10 minutes. So what we've done is we've changed those minutes into units. So we've assigned 1 unit as 10 minutes, 2 units, 20 minutes. And so you'll see why that matters when it gets sent over to the procedure module. Okay. So what happens is the end user will go ahead and select the service that they provided. A unit pick list will pop up, and then they can go ahead and select the amount of time that they used providing that particular service. You can, if you want, add in some informational type of pop-up so that the end user has a little bit of a description of what that particular service entails, so that they know if they're selecting the correct one. Okay. When I talked about downloading the template, so this is the parent template. This is the main template that your end users will work off of. And then I mentioned that there were 2 other pop-ups. This is one of them, so the Health Education Supportive Counseling. And we've added that as a pop-up. These pop-ups are great because they're an extension of your parent template. They don't take up a whole lot of real estate on your main template, and you can just continue to add to that particular pop-up if it's part of an additional health education service or supportive type of service that you want to add on. So again, if you look at all the codes, your organization may want to start to think about if you're not collecting anything right now, it can be a little bit daunting to look at the hundreds of codes that are available. You may want to decide or really determine what services you are providing, what services are going to be most valuable for you to track. And then it's not to say that you can add on later. Again, the great thing, and we'll go over this in part 2, is what you download doesn't mean you have to use everything. So on Template Editor, we'll go over that, how you can hide some fields and then unhide them later if it's something that you think you want to track. Okay, and the other pop-up is that Interpreter Services pop-up. And again, you can add in these kind of informational pop-ups just to let the end user know or provide them with detailed description or further information on the particular service they've selected. And moving down to the bottom, you'll see that earlier I went ahead and I selected a PCP assignment service code, and then I went ahead and submitted it to Superbill. All that means is in this particular workflow, we have the end user submit it so that it gets saved to the procedure module in EHR. That link, if you recall, is to that SSRS report. That SSR report pulls from the procedure module. So I'm going to go ahead and submit our CM referral that we checked here that we have not submitted yet. And then I'm also going to check off that what kind of encounter it was. So we assisted the patient while they were here. So in person with the patient, I'm going to submit to Superbill. And now if you saw that little blurb that came up. So this is our PCP assigned. So, and this second column here, the code, remember that's the service item code that you need to set up. So when I talk about preparatory work, what I mean is if you don't have that set up to begin with, when you try to submit that code to the procedure module, it's going to error out because there's no code for the system to pull. So that's our PCP assign, our transportation code that I had submitted earlier, our CM referral, and then our in-person. Now when we talk about the units of time, that's this here. So because I chose 10 minutes, then it assigns that 1 unit. And so that's going to determine, and then you can convert the units into the amount of time that that user actually spent on the reporting side. Okay. There's also, if you have, we have templates that work in tandem with this. So print document would be if a case manager opens up their visit note, they have a separate template. So this information will get inserted into their case management encounter notes. Our nutritionists, our RDs use this template, so they have their own medical nutrition therapy template that we've created, and these service codes get inserted into their visit note as well. And then just very quickly, just so you can get an idea of the utilities that you're going to need to use. Really, it's going to be your, of course, your EHR that gets you into what we're looking at now. That's your for your front end user. Your practice management section, that's where you would need to go to set up your EPM report. Your file maintenance, that's where we do the preparatory work, set up your CPT code, set up your service items there. Your template import and export, that's the utility that you're going to need to use to download the template and then import it into your database. And then template editor is where you're going to need to go on the back end to resolve any kind of maybe template issues, or if you want to hide service items that maybe you're not going to use from the get-go. And that's it. Heather, back to you.
Wonderful. I'm going to switch back to my screen real quick. We can do some next steps and Q&A. Wonderful. Okay, so this is the information about some of the next steps. So here's where the enabling services template is available. And then the next thing on here is also there's, Chrissy has mentioned multiple times that August 3rd, there's going to be a part 2 webinar on enabling services. And so again, this is going to be the part 2, which is the template demonstration and troubleshooting. And I know there's quite a few questions coming into the question box. So I want to move us to be able to answer questions. But there's also on the screen, you'll see some of the email addresses for the different folks who put this together. So if you want to ask questions between now and then, that's also available. So I'm going to start us off with some of the questions in the question box that have been asked during this thing. And I know there's quite a few people on the line in it who have background in enabling services, so I'm interested to see what people think. Oh my gosh. Yeah, you can register for part 2 by go ahead and clicking on that register here, or you can copy and paste it into your thing. And we will be sending a recording along after the session is done. 1 second. So some questions for if people have a UD2 hotfix 78 and KBM 8.3.8. And that is from Larry Chu. Larry, do you want to give us more information about that question? I can unmute your line. 1 second. You're not unmuted. Question? Larry? Hello? Okay, so let me mute that back up one more time. So we had a bunch of questions from, I believe it's Mika Aoki. So Mika, I'm going to go ahead and unmute your line to ask some of these questions real quick. 1 second. Awesome. Mika.
I can.
Yeah. Go for it.
Hi, good afternoon. I have multiple questions, so let me see if I can go down on the list. So first one was, when you were showing us the report from an EPM, there was a location name, and the location name of what I saw was like a case management or transportation. So it was, but on the actual template itself, when the template location name was actually like a clinic location name, it looks like. So where is that differences in, information coming?
So on the so there's 2 ways to look at it. So we set up a location or for that's actually called transportation. So they'll select that. On the template side, our case managers wanted to know the actual physical location, well, I'm not going to say it's not clinic location, but whether or not it was an office visit, a home visit, the office, I think, place of service. I'm going to use that because I think people are more familiar with that. The location on the template would be your place of service. And then we have a clinic location. So for case managers, I'll give you an example, and it can get, it's an internal decision on how you want to make that. So for our case managers, depending on where they're working out of, because we have several locations, we may have just case management, which is known that if it's just case management, then here's the main center. If it's a case manager who's working at Nanakuli, they may have case management Nanakuli as their clinic, and the place of service would be either 11 for office, 12 for home, and then 99 would be other unlisted facility. So if you're familiar with on the billing side, which we don't, but it's linked to the EPM and so reporting. So other unlisted facility might be like a shelter, or might be a homeless home visit could be either at their home or maybe if the person is homeless. So that's the difference there.
I'm sorry, Chrissy, I couldn't hear like the first part of your response.
Okay.
So it wasn't really, I wasn't able to understand, but yeah, it's okay.
Okay, so I'll try again. Oh, can you hear me now? Is that better? Or
I can, yes.
Okay, so just really quick, the difference, there's two ways to look at it. So you have your location, so your billable location. I'm going to say, so if you're familiar with NextGen, it's that billable location that you'll see at the top of your EHR screen, and then on the EPM side, any kind of appointment or encounter will have your location. That's the billable location. So in our case, we actually created a location called transportation. And I think you saw the place of service on the template, which holds a place of service code. So you have either it was an office service, which would be 11. You have whether it was a home visit has another code 12, and then some other unlisted facility, which might be a homeless shelter, has a 99 code.
And then what was the reason that you decided to have the location name that are called like case management or transportation, other than just looking at, because I know you have a service item, so you can actually track the service item to see what services are provided. And then of course you have the actual point of a service, which it will show the actual location. So what was the reason that you have the location name that has transportation case management?
So just for tracking, I'm not going to say for billable purposes, but so it keeps it separate because we have multiple locations, and just by case management alone, and then maybe your service item may point to it. I'm going to say just from our case manager or case coordinators department, they wanted to use place of service, include place of service in their report. So again, I mean, internally, it's up to you on how you want to set that up. I think they just wanted it a little bit more detailed.
Okay.
And I can find out. Yeah, I can find out more information too from our case management folks to see really how they use that place of service or why that's important to them.
Sure. Yeah. Maybe. Yeah.
Okay. And then I can go ahead and if you want to email me.
Okay.
And then in that way we can connect that way. Yeah.
Okay, great. Thank you.
Okay.
And another question is, so NextGen standard templates, and my plan has where you can record your education, health education, and counseling topic and time. So that page, that particular template serves as, I think, both documentation of the service provided as well as the code submission. So you're not using that particular template, and you're using this template?
Yes. So just to get a little bit of background, we purchased our system in 2000, and then we rolled out in 2002. And so our data, and at that time, NextGen didn't have a whole lot of templates available for us to use. So we really, our database is very customized. So we don't use their framework setup right now, although we are on the latest KBM version, and we are on UD2. We went ahead and were able to integrate or bring forward all of our custom templates. So for meaningful use, I mean, we still track the health education that's provided to a patient, but as far as the particular enabling code, the HE codes, those are all collected and documented through either this template. So the template that I previewed today is the one that you can download, but we also have, keep in mind, we've also incorporated a lot of the service items into everyone's workflow. So we have things that make sense to be on a telephone call template. You know, if a receptionist is assisting with a patient with setting up transportation to a specialist that they have to see in town, the receptionist doesn't necessarily need to visit this particular template. While they're documenting the telephone call, it's already integrated into that workflow.
So let me see if I understood that part. So if they were using telephone template to do, you know, some of those enabling service-related activities, that telephone template itself now has a way to just submit the code, submit that enabling service code directly from there. They don't have to come to this template to re-enter the data.
Yeah, so they have a link to go ahead and add in the codes or the services that they provided. And so you could do that really anywhere.
Right. So for that, though, you have to basically customize that template, not ES template, right? I mean, ES template is just ES template. And then if you wanted to have a different template to be able to collect the same data without using a ES template, then you would need to customize those different templates at the different places. Okay.
Yeah, so you could either do that or just create a link, like add the link to your left navigation bar, or add a link to that particular template that either brings up a pop-up, so those services that are specific to that particular encounter, or a link that, you know, brings this template up. But you bring up a good point, though. So if there's any other customizing that needs to be done, then you as an organization would have to think about the resources that you have available, if any, at your site to do that. And then also thinking that there's not a whole lot of maintenance because the codes don't change, but I mean, there may be times when you want to change the workflow, or maybe you want to add codes. So that's where the maintenance part of it would be. So yeah, so the things to think about when you're customizing the templates. My department here, besides myself, I have 3 other analysts on my team. So we have a dedicated EMR staff here.
That is a good question. So you have, because like we have one application specialist. She's essentially the only one able to do a template modification. So are you saying that you have a 3 individuals who can do a NextGen related template modification and upgrades and all that?
Yes. Mm-hmm.
Okay.
And then we have a separate IT department as well.
Right. Okay.
Mm-hmm.
Thanks, Michelle.
Welcome. And then so email me, Mika, and I can get you the information on the case management location.
Oh, great. I will do that. Thank you.
Awesome. Thanks so much, Chrissy, for helping iron out some of these questions. So we have about 8 minutes left, and I want to make sure anybody else who has questions gets those answered. So if people want to use the raise your hand function, it looks like a little hand in the bottom somewhere on your control panel. Let me know, and I'll unmute you, and we can answer any questions. But just looking at some of the questions from the chat box, people want to know if you can handle this if they're hosted by NextGen/Dell for the EMR and EPM. So Chrissy, is that something that's possible? Do you know? I mean, it seems like this is through NextGen anyway, but if Dell is also on that.
You know, I'm not sure. John, are you still on the call? Would you know if any difference if an organization is being hosted by NextGen? Because yeah, we we have we manage all of our own data here.
So you're asking if a cloud provider or hosting provider that actually hosts NextGen will it allow this type of template or custom templates?
I think that's the question.
I'm not sure. Yeah, but I mean, it seems to me that well, I don't know for certain. So is this you said it was NextGen Dell? Is that correct? And is that NextGen's primary? This is not a third-party hosting company. This is NextGen's own cloud service provider.
It's a good question.
Is that correct?
It's a question that came in through the question box, and it's from not to put someone on the spot, from Linda Lovelace. And so if Linda's able, I'm gonna try and unmute you to see if this is possible to get that question answered. So 1 second. Linda, did you want to ask that? Hello, Linda? Hello? So it seems like the person asking the question is not able to be answering, so we can do that in our part 2 follow-up. I'm going to go to anybody, the folks who has their hand raised. It looks like, oh, sorry, Linda. So she says, yes, they're hosted by NextGen.
Yes. So I don't know for certain how much. I mean, does Linda know whether they allow customization at all?
No, 1 second, Linda. Let me try and unmute you so you can actually answer some of these questions. Linda, if you're connected, can you go ahead and answer some of our questions? They're hosted by Dell. It's possible to import custom templates. They have to pay for it.
I guess it might be easier, Heather. Yeah, Dennis, John, I was going to say I could follow up, or if they want to, they must have a account manager or someone that they can ask about working with custom templates.
Mm-hmm.
And then I can certainly find out too.
Absolutely. I mean, I'm not sure if we can resolve but it does sound, yes, it sounds like it's an extra service that probably has to be paid for, and so that probably has to happen. But yeah, like Christy said, Heather, maybe we should try and follow up with this later.
Sure, sounds good. So let's follow up with that later, and especially somebody else said they're Dell hosted, but it's possible to import custom templates. So let's go ahead and for those folks who are wondering how this would work specifically on their Dell hosted or NextGen/Dell hosted, let's email us later and we'll kind of delve a little deeper and follow up on that. Is there anybody else who had other questions in the next 3 minutes? Feel free to click on the hand raised item. Anything else? Oh, one last question that was in the question box is, does the worker go into the patient seen by? So there's a blank spot that says provider, and then there's another person that says patient seen by. So would that be so like if it's a community health worker, would they put their name in that, or how does that work?
Yes, good question, and I meant to show that, so I'm glad that someone brought that up because I actually forgot about it. But yeah, so the PCP would be, that gets populated based on whoever the PCP is listed on the practice management side. The patient seen by contains a list of we set up a case management database tick list. And in part 2, I can show how we set that up so that you don't have a list of all your users in your organization. You really just have, in this case, it'll be someone, a case manager, or someone who would go ahead and provide the service, provide a particular service. Yeah. Or seen by provider.
Awesome. And it looks like we have, some 2 hands raised. So Kimberlyn Barnes, I'm going to put you on unmute. So 1 second. Oh, I actually don't think you have the audio pin enabled, so I can't enable your question, but if you feel free to put it in the chat box and we can ask that. And then Margaret Scott, I believe your hand is up. So I'm going to try and unmute you and see if you'd like to real quick. Margaret?
Yes. At the bottom of the template, there was a print document button. So I wondered, is the document specific to the template? Could you show it?
No, actually, the print document is there's no document associated with this particular template. When you click on it, it'll show you different connect documents. So it would either be a telephone call, it would either be maybe a generic master IM template, which would then just once you get that, it pulls up the code. But for our purposes, we have it connected to, like, I think, so our nutritionists, our case managers, those codes get inserted into the clinic visit note. And then in part 2, I can show just the master IM template. It's really just the codes that we selected. It's basically in a document form.
Okay, thank you.
Yeah.
Wonderful. And so just as an FYI there, Kimberlyn asked a question in the chat box, which is there a way to stop the encounter from being billable and just be clinical? I'm a little confused about that.
Well, yeah. Well, and that's how we have the code set up in service item, because once you send the code to the procedure module, and we just did it that way because it was so much easier to set up the SSRS report to pull from one table versus having to pull it from the template table. So if you notice on the service item side, and we'll go over this in part 2, you select it so that we suppress it from billing. So even though it's marked off as billing, it doesn't go to a holding tank. It ideally, specifically, it just sits in the EHR procedure module table. So it never goes to the charges table in EPM.
Awesome. So that makes a lot more sense. Thank you so much, Chrissy. And so we have a few more questions, but I'm recognizing it is at the hour, and I want to be cognizant of people's time. So feel free, definitely take any notes you need from this last slide. We're going to be sending out both a link to register for the August 3rd webinar, and as well as the template, as well as the slides later on. If you've entered questions in the chat box that are still unanswered, I know there's a conversation about interpreters and things like that, sharing more experiences about how the rollout of this went out. We will either be able to answer that in the part 2, or if it's something we want to work on in the meantime, feel free to email us directly, and the email addresses are right there on the screen. So with that, thank you very much. And thanks so much to our presenters.
You're very welcome. That was good. I hope that was helpful, and I look forward to part 2.
Thanks, everyone.
Thanks, everybody.
Aloha.
Thanks, Heather.
Bye-bye.
Bye.